So our today's topic is epidemiology study, relation with the pharmacoepidemiology with what epidemiology study and design, how they design. So what are the sources? The source of drug data includes, first is institutionalized medical record and database from hospital and pharmacy claims. So mostly this has to be collected from the hospitals, and big hospital institutionalized medical record wherever from the database. Mostly in developed countries, they have a database in their pharmacies, and we are in a developing countries. Still, developing countries are far behind of with developed countries. So what they do, system-wide database from health insurance claims. So mostly in our country, they have just started about insurance claims. Still, they have given some health card, whatever it is. They are all related to that system of insurance. So mostly in developed countries, they have insurance system or they have a national health system. Wherever their nationals, they go for treatment, they receive medicines, pharmacy, and their government have to pay for their health medication, whatever it is. So they can have the data from there. Since central, they have a national database like medical expenditure, panel survey, national ambulatory measures. So still, in developed countries, they have well record maintained over there. In our countries, still, it is not according to that. Then they field data like records from dispensaries, seller, distributors, or from where they have to collect the data of medications. Then the experimental clinical data, experimental clinical trial data. If you may learn in fourth year about the experimental research. When drug which is going for experimental before marketing, they go for a human trial. So that is experimental drugs. Research data have to be available at this. Studies can be divided into two main types. Epidemiological studies can be divided into two main. One observational study and second interventional study. So further you can see in this table there is epidemiological study have first observational, second interventional. So observational has descriptive, second analytical. The descriptive have further ecological studies, case reports, case series, cross-sectional. In analytical, you have to learn the cross-sectional, case control, cohort, concurrent studies, non-concurrent, hybrid designs. So for interventions, you can have clinical trials, field trials, community community interventional studies. These all has to be incorporated in the main study of epidemiological study design. So they have to design like this. First, epidemiological studies, observational, second, interventional. In observational, further descriptive, analytical, ecological, case reports, case series, cross-sectional, analytical, cross-sectional, case control. So these all have to be designed according to that when they're going to study in epidemiological study design. Now, what's observational versus experimental design? You can compare both. In observational studies, allow nature to take its course, investigator measure, but does not intervene. Descriptive studies focuses on the description of the occurrence of a disease in population. Third, analytical study analyzes relationships between health status and other variables. Now, for experimental or interventional studies involves an active attempt to change a disease, determinants, example, an exposure or a behavior or the progress of a disease through treatment. These studies are based on a group which has had the experience compared with control groups which has not had the experience. Now, purpose of descriptive epidemiology is that what they do, they generate hypotheses. What hypothesis? They permit evolution of trends in health and diseases and comparison among countries and subgroups within countries to provide a basis for planning, provision, and evolution of health services, to identify problems to be studied by analytical methods, and to suggest areas that may be fruitful for investigations. Now, case report is that documents unusual medical occurrence can represent the first clues to the formulation of hypothesis. Generally, reports are new or unique findings, previous undescribed disease over there. Example is that Zappacosta presented a case report of a patient treated with minoxidil that was discovered to stimulate the hair growth. So actually, minoxidil is a vasodilator. Actually, it was a blood pressure reducing drug. When there is a there's a vasodilator, when they given vasodilator, they reduce the blood pressure. So minoxidil was basically vasodilator, but it was applied now in this hair growth. You may have seen various solution of minoxidil that can apply over the scalp of patients to increase the hairs. So that was actually it was the side effect of that minoxidil, but now it is used as a hair growing on baldness. So a topical formulation of minoxidil was developed to take advantage of that fact. So actually it was not initially it was only for that one vasodilator for antihypertensive, but when they found that, they decided that they also can helpful in growth the hairs and scalable. So nowadays it is developed for hair growth. Case series, collection of individual case reports which may occur within a fairly short time. Experience of a group of patients with similar diagnosis or has to be done. Example is Krishnamurthy and King reported on the adverse effects associated with the use of olanzapine in 5 children with severe behavioral problems. So these were the adverse effects which I reported of olanzapine. So adverse even included, they are going for weight gain, sedation, and akathisia. So that has to be reported where someone has reported that these are the side effects of the drug. So while they are prescribing or application, they can be given very carefully. Further go, case series, advantage that's useful for hypothesis generation, informative for very rare diseases with few established risk factors, usually of short duration. Disadvantages, cannot study cause and effect relationships, cannot assess disease frequency. Simvastatin, Becol, an effective and inexpensive lipid-lowering drug, was introduced in 1997. It was removed from the market in 2001 because of reports of fatal cases, muscle breakdown, rhabdomyolysis. Although these statin can cause rhabdomyolysis, but this drug have severe effects. They have tried as rhabdomyolysis. There is a tear in the muscles. It happens, tear in the muscle when they take these statin, mostly in cardiac patient, it has to be statin can. It was a big call that, so they reported that it gives a severe fatal cases of muscle breakdown. So that was rhabdomyolysis. Mostly these statin, they may cause rhabdomyolysis, but it is a minor effect. But when it has reported that, so that was removed on the basis of the data which they have collected. Ecological study, obtain group level exposure for information and disease prevalence at the same point of time, but the ecological study has to be done. Cross-sectional studies was published by Dua and colleagues who examined inappropriate sale of antibiotic use in pharmacies in Nagpur. Such studies can identify problem area and suggest where remedial action should be directed. Cross-section advantage is that, what advantage? Best for determining the status, prevalence, quick, relatively inexpensive. Disadvantage, only a snapshot at a time, leading to a misinformation response rate may be low, with results not representative of the population over there. Correlational study designs, a study comparing incidence, prevalence of one event against another on a global scale. Measures that represent characteristics of entire population are used to describe the disease in relation to some factor of interest, such as age, calendar time, food consumption, drug use, and utilization of health services. Correlational study designs advantage compares event amongst nations. Disadvantage doesn't compare individuals, so it might lead to overgeneralization.
Sir?
जी बेटा.
Sir, Madiha Naz